There we go.
There it is.
We just gave so much insight into getting a virtually new Apple product.
Yes.
Oh, we should have recorded. My bad. That's my bad.
It's all good. It's all good. Listen, that's stay tuned for part 3.
And now I'm literally about to go to the Apple store on Saturday morning. No one's going to be there because no one heard this. Yeah.
Exactly.
The lines will be empty. Oh man. Oh man. Okay, so we hit the foundation. We hit dental school at Lecom. Jesus Christ, 50 students. I thought 5 or 10 was a lot. At Stony Brook the other
50.
year, they increased by 4. We went from
Okay.
no, 2. It was 2. We went from
Okay.
44 to 46. And
Okay.
there was literally no, they're not increasing faculty. In fact, they lost faculty. They're not
Yeah.
increasing the clinic size chair opportunity. They opened up a new digital dentistry lab that so there was a lot of staff. Well, not. Let's just go into. There was a lot of staff that left, or they didn't replace, or so on and so forth. And the way they replaced staff members that have been working there for 5, 10, 25 years and retired, or just left because they weren't getting paid and they were being asked to have more responsibilities. This is 5 years ago, 3 to 5 years ago. They replaced those with students, and they gave them students. What's it called? Student student worker.
Yeah. I know what you're talking about. I just can't think of the title, but I know what you
Right.
mean.
They have these students working part-time in these
Right.
roles that they didn't fill, and then they're giving them half the wage.
Yeah.
It's insane.
I mean, LeCom honestly kind of did something
Oh,
similar. They offered a tutoring program to where you could tutor other dental students as you were older, but they were going to pay you pennies on the dollar. And I initially signed up for it. And number one, the paperwork trail and the headache to get everything signed up and to get you in the system as an employee, and you had to get like ID'd and all this other stuff. And then you were going to get paid like something ridiculous. Like you were going to get paid like $2 or $3 an hour. Like so not worth your time. It's like it was so ridiculous. I don't remember the exact number, but I remember looking at it and I laughed and I was like, yeah, I think I'm good. I'm real good.
are you kidding me? Do you actually want students to be mentored? Figure something out that's worthwhile. I mean,
Yeah.
you got the upper class students worrying about managing didactics on top of their clinic load, hitting requirements, applying
Right.
to graduation, taking the board exam.
Yeah.
Think about your students. I anyway, we could go on and on. So let's change gears here. Let's go fun. Let's go exciting, a little
Okay.
entertainment. So I'm seeing these posts. I don't know if you noticed on Elite
Yeah.
Dentist. I put up Dr. Jocelyn Vita yesterday. I put
Yeah.
you up today. Tell me a little
Uh-huh.
more about that. How'd you get
Listen,
to, isn't she
listen,
in?
listen, we saw what you did there.
Oh yeah.
I saw the message. And she goes, that's so funny. And I was like, no, you don't know. Like, I know Brendan. I
Oh,
understand.
you know. Wait, isn't she? She's not in Florida, is she?
She's in Orange County, California, in Mission
She's a
Viejo.
California. Yeah, she's in California. How'd you guys link up? How did this connect?
So honestly, it goes back 3 years ago now. We host her on the podcast. So let's even start before that, right? I stumble upon her on Instagram, go, wow, okay, amazing clinical work, beautiful person. Seems like she's really got it going on. I was like, we have to talk to her. I was like, we have to talk to her. And I reach out to her. She's super friendly, says, of course, let's do a podcast episode. We have a podcast. After we get done with the podcast, we have an amazing time on the podcast. I'm talking with the guys and we're like, she's awesome. She's incredible. And I even say to Matt, he's my best friend in the world, love him to death. Him and I are like,
Matt, yeah.
him and I are like this. We're very similar. He goes, that is the caliber of woman we need in our life, Cole. I was like, say no more. I understand. I feel the exact same way. So, years have gone by. Her and I have had different people in our lives at the time, but we've always stayed in contact. We always, on holidays, if I have any questions about anything, I've messaged her back and forth. She's messaged me. We kept in contact on the holidays. We always were in each other's lives. And we didn't know this, but we secretly always had a thing for each other. It was just never spoken. We always secretly were thinking about one another, but weren't really kind of taking it that next step further. Just nice messages here and there, checking in. And I said, you know what? We were getting closer to December time. this past December. And I was like, you know what? I'm going to start to get to know her more. So right before December, we start messaging a little bit more. And I was already thinking about doing an externship, and I wanted to do it in prosthodontics. So I was like, okay, well, I want to do an externship in pros to learn more about pros. Even if I'm not going to be a prosthodontist, I want to do more comprehensive full mouth cases. So I want to be at that level. So I messaged her and I was like, you know what? Like, I want to double dip. I would like to come see you. And I would like to also do a pros externship. What's probably the closest school to where you're at? And she
How
said,
long ago? How long ago was this?
this was in December.
This last December.
December. Yeah.
So like 5, 6 months ago. Okay, okay.
Right.
So recent. I didn't know if this was like 2 years ago, 1 year ago.
No,
Okay.
this was yeah. So December, right? So she says USC because that would be the closest, even though it's not super close, probably like an hour 15. I was like, all right, great.
Not bad.
So I hit up USC. I booked the pros externship. I go to the pros externship, learn a lot, have an amazing time. We go on our first date, if you will. And it honestly, from right there, Brendan, the first time of my life, I went on a first date with somebody and I said, okay, I'm buckling up. That's it. Doesn't matter.
Just like that.
Just like that. And then literally a week, 2 weeks later, I said, all right, I have to go back out there. I don't know what it's going to take, but I have to go back out there. So I got an interview request to go at her office to go see her, basically shadow her, do like a full cosmetic day. She did basically full mouth three full mouth veneer cases that day. I went in there. We had the best weekend I've ever had with anybody. And that weekend right there just sold the deal. And now we've been taking weekend trips here and there. We met up in Scottsdale one weekend. We met up in Austin, Texas this past weekend. She came to, me and Destin here, Florida for my birthday weekend. I've been out there twice. We're about to meet up again. And honestly, dude, it's exactly what you need in your life. Truly, it's
Oh,
what you need in your life.
that's amazing, man. That
Yeah.
really is. Dude, like an hour and 15, that's nothing. In the grand scheme
No,
of
it was
things,
nothing. Yeah.
that's nothing. That's nothing. And so you were shadowing her at her office. Is that her office? Is she working at someone's
Yeah, so
office?
it's her office. So Vita Dentistry is her office that she runs in Mission Viejo, California.
And Viejo, is that north of USC, south? Is that
South. So
eastward?
it's in Orange County.
Okay,
So
okay.
Los
I
Angeles is in, the
Yeah,
Los Angeles area, and then if you go south, probably like an hour, it's in Orange County officially, just close to Newport Beach, Laguna Beach, right around that area.
and like you mentioned how you got so long distance is tough, and that's one of the longer
Definitely tough.
distances I've heard of.
Yeah,
Florida to California, but something I want to make note of. You mentioned, and like, look, I mean, podcasts and whatever, but like just making note and like thinking of strategies and stuff. You guys are making the most of traveling. You're meeting halfway. You're getting
absolutely.
to see different spots. I mean, you were in Texas, you were in
Yeah.
Arizona. You're going to vacation destinations. You're seeing each other. You're getting to travel a little bit. I mean, uh, I never thought of these things. That's genius.
Well, not only that, like I also pivoted a work trip and a business trip into a fun trip. So the trip that we went to Scottsdale, I actually was going out to Albuquerque, New Mexico to go to the Thrive Dentist conference out there, which I went to for a couple days, which was amazing, phenomenal conference. It had an awesome time meeting some really awesome individuals in the profession. And then from there, I was like, well, I'm already very close. Let me take a 45-minute quick little puddle jumper flight right over to Scottsdale. And then we pivoted and made the most of the weekend. We had 36 hours, but hell, we filled that 36 hours with a lot of fun and a lot of cool stuff.
A lot of coffee, a lot of
Yeah, exactly. Just stay
no
awake.
sleep.
Yeah, exactly. Just keep it going. No, we had an amazing time. And that's the best part too, is about, what I tell anybody about, kind of finding your person, if you will, is you have to find somebody that, number one, inspires you. So that's kind of how this whole thing started. She was somebody that I aspired to be like. She was an inspiration to me with the gorgeous work that she does. And here I thought, I was like, you know what? She'd never give me the time of day. But that's not the right mindset. The mindset was I always just had to trust my instinct that you just got to go for it. You got to go for it and you got to be who you are. And at the end of the day, if you're who you are, people will see that and they will realize who you are as an individual, and you'll link up with like-minded individuals. And we found out that not only is she truly the person that motivates me, inspires me to be the best version of myself, she's my best friend. She's the person that I could talk to anything about. And she motivates me to truly be better every day.
That's incredible. So rare to find that too, both the best friend, but Did any of that kind of spark? Was it during COVID? Was it before? I know my girlfriend, when we linked up, very similar situation, but she's not in dentistry, so a little different as far as that goes. But same thing, inspiration and whatnot. COVID really kind of reset my mind, what I was looking for, what I knew I needed, what I wanted, and then kind of all package it together. Did that kind of spur? Because you said you started speaking like a couple years ago, right?
Yeah, so like height of COVID, honestly, that was really the inception of her having more time to talk to us, and some of these other people too that we met on podcasts and with DSV. Some of these people had more time at home, so they were able to reach out to us and actually speak with us and give us a little bit more time because they weren't in the office clinically working. So we were able to
Right.
kind of link up that way. And that was also something that, we talked about in the beginning, Jocelyn and I. She was talking about how the fact California is a little bit more strict than how we were in Florida. She was under a little bit more intense pressure to kind of keep things a little bit more reserved at the office, and just, kind of scared for her own health as well. Because, at that time when everything first started, we all really didn't know what was going on. Everybody was saying a lot of things, but nobody knew the truth about anything. So
No one
yeah,
knew what the hell was going on.
yeah,
Yeah. Yeah. So, yeah. Now you mentioned Scottsdale, Arizona. You mentioned Texas. Are you going to go into a specialty? You said probably not going to go into pros. You just want to do an externship.
probably not. Yeah, it's honestly, so to give you, truly in my progression through dental school, what I found, what I'm passionate about, and it goes beyond just what I'm passionate about in dentistry, just what I'm also passionate about in the future. I want to be able to do everything, because that's just my personality. There's whenever I can't do something, I feel as if I'm not at my full potential, and I feel like I could be better. So whenever there's something I've encountered in dentistry or in life that I can't do, I'm like, all right, well, I'm going to learn how to do it. So that's just always been my goal. So I've had many patients come in my door, just being in third year and now fourth year clinic, where I say, this is really complex and I don't know how to approach it. And there's been a couple of situations where I'm like, especially in the beginning, I don't know how to pursue this. I don't know where to start. What do I do? Or I don't have the skills yet to do it. But I've said, you know what, I'm going to learn. So I've, progressively started learning more, doing that pros residency, kind of linking up with some of these other individuals that do more comprehensive full mouth care, picking their brain, getting ideas from them, and then starting to do some cases myself. Like I just completed this case. I'll share a picture with you. So I did the third molar extractions on her. I did her wisdom, third molar extractions. I did her endo. I did all her fillings. I did chairside composite veneers. I did fixed bridges. I did laser gingivectomy. I did everything by myself. And I did everything correctly phased and sequenced the correct way. And at the end of the day, I got the aesthetic outcome that I was going for. And at the end of the day, that's all that matters, right? We're trying to make our patients happy. We're trying to learn, and we're trying to find what truly motivates us to, be better and do better. And I found that doing this profession the right way, which is picking the brains of the people that do it the best and trying to pick up their tips and tricks. So here you go. There, I'll show you a picture there.
Oh, wow. Oh man, that's a huge difference.
Huge. So we were able to change this young girl's life
Mm,
just like that, with just
beautiful.
making sure that as a fourth year dental student, you actually, you remember this, a case like that wouldn't be something usually that you're able to, tackle or even able to physically do. The dental school probably would even tell you, like, I don't know, maybe you shouldn't do this. But again, in myself, I said to all my professors and the people that were there, I said, respectfully, your average student probably wouldn't be able to handle this. But number one, it's all about mindset too, right? I had channeled the mindset of, I'm not your average dental student. I'm somebody that I really want to help this person. I'm going to learn how to do this along the way. I'm going to consult all the specialists. I'm going to consult all the docs. And this is going to be my first real big case to where I've done all the pre-steps before to get me to where I need to. Now I'm going to put all these pieces together and we're going to get the best outcome for this girl possible.
Oh yeah. Oh yeah. I like that you went to all the specialists required and necessary and made sure that everything ran by them, and then you did what they recommended to do, and you hit every piece.
Because the big thing was too, that I learned actually at that fixed prost externship at USC is that you learn that the prosthodontist truly is, in essence, if it's a comprehensive full mouth case, they're the quarterback. Everybody has their role, but they're the quarterback because they're going to be dictating the final treatment. But they need to make sure that all the specialists, everybody's in line and does their part in order to support their final prosthesis, so that they're going to place, whether that's implants, whether that's, an implant supported prosthesis, whatever it is. they have to make sure that everything leading up to that done by all the other specialists is everybody's communicating well, everybody's sharing the information so that everybody has the same goal. And we end up with the exact what we've envisioned as our final product is actually what translates. So then two, going forward, I want to be a comprehensive provider, but I don't want to do that forever. And I mean, I'm sure you don't as well. You know, I've through this whole networking process and through podcasting and through mentoring, I told you my true purpose is I want to help mentor. I want to make this profession better. And I want to help young individuals realize their true potential. So eventually what I want to do is I want to kind of take a step back from the clinical. I want to, you know, have my businesses running, but I want to step into a more of a mentorship role. Maybe that's being full-time CEO of PDA or full-time CEO of another company. Like that's probably what I'll end up doing at the end of the day. I'll be a clinical dentist for a while, but I don't think I'll be a clinical dentist forever.
Yeah, of course, of course. I mean, dentistry, you know, as much as we sometimes some people don't want to accept it, it's very physical. It's very
Right.
physical. I mean, the amount of the hours, it's all physical. You're on your feet, you're sitting in a chair, you're looking through loops. It requires hand skills, it requires eyesight. You know, we get old, our bodies get old, but our
Right.
minds get sharper. I really do. I think they get sharper until you stop feeding it. And you got to feed it complex cases, you got to feed it challenges. So I 100% agree with that. As long as mentorship is at its core, because I see a lot of that's what the whole. I mean, this is just my idea, opinion, what I've seen. The concept behind the DSOs or that it's someone that was trying to take a back seat, you know, trying to make money off of the dentists that they're employing at the practices who are doing the work, who are doing all the work,
Absolutely.
right? But you know, you just because you're 75, you're not doing it anymore. I get it. You own 17 practices and you're taking a cut of all the dentists doing all the work. Why don't you mentor them and then just own the real estate underneath? And then you're making a lot of money, but then they get to keep a little bit more because they're doing the work. And you know what?
Right.
They have a lot more loans than you had when you graduated now that you're 75. I think there's a lot of
Absolutely.
things. They're not getting reimbursed for these procedures by insurance companies the way you were 20, 15 to 25 years ago. You know, I mean, what I mean is reimbursed the same way, but the
Right.
profit margins are less. The less the profit margins, the more dentists have to smush and cram into their schedule. The more patients cram into the schedule, how much attention and focus and ultimately better care
Yeah,
is each patient getting?
you're compromising quality for quantity to make the same amount of money, which it shouldn't be about money, but at the end of the day, also we have to be business owners as well. We have to make a living, we have to move forward. So it shouldn't be that way. That's
If you're making
unfortunately the we
exactly,
mentioned
if you're
before
making half as
yeah,
much, you need to fit twice as many patients in an hour.
right.
And you need more focus. I mean, you get what you pay for. You need a certain amount of time with the patient to look at the full picture, to spend time with them, to explain them the treatment options and the 5 year plan from the 5 month plan. Like you need time for this. This isn't talked
Yeah,
about
and to
enough.
figure out their motivation. You know, the biggest thing I just talked about, I had a podcast last night with Dr. Christian Pavel of Dental Yogis, and we had an amazing conversation about, you know, taking a step back, breathing, and allowing that opportunity to really truly get to the core of what that patient's motivation for treatment is. Not to be a good salesman, not to be anything but a better doctor. Because at the end of the day, that's what we are. We're doctors. We're not dentists. We're not oral surgeons. We are doctors at heart. And whether that means we help an individual realize their full potential, like I hope to do, whether we, you know, do a surgery that's life-changing for them, like you'll do in the future, whether we'll, you know, do a big comprehensive full mouth rehabilitation case and give them their confidence back and help them in that regard. At the end of the day, we should be able to take a step back, hear this patient out. What led them to come into our door? What are they really seeking? Are they seeking a brighter, whiter smile, or do they just want to be out of pain? What truly motivates them to be where they are right now?
Exactly. I couldn't say it better myself. That's spot on. Yep. 100%. It's phenomenal. No, you know, and we've touched on so much. I really think, you know, talking with you, I really know that the future of dentistry is going in the right direction, such that we stay that course. You know, and we got to stay the course. We got to make a difference. It's going in the right direction. We need advocacy in dentistry. We need to get the insurance companies to kind of revamp themselves. We need to get dentists as a whole in the United States and the world to get all the technology, get all the techniques, just like you said, they do things certain ways here, they do things a different way there. Let's find what's best and let's bring it all together.
Right.
Yeah, yeah, no, dude, Colt, we're really touching on something. It's really making me optimistic. It really is. And you know how hard it gets in clinic, how many patients you got to see, the different personalities, the amount of work you got to do, the weekends you give up, the sacrifices. We love it. We do. I mean, let's be honest. We
We
love the
do.
sacrifices. We do it for the lifestyle. We do it for the patient's smile at the end of the day.
Yeah. Absolutely. Life changing, whether it's comprehensive full mouth care, whether it's just you're giving that patient the education. I can't tell you how rewarding it's been up being up in the panhandle of Florida here, where access to care is so limited and education is so low. How quickly I've changed a patient's perspective just by taking an extra 10 to 15 minutes with them, explaining how they really properly should brush, floss, how they should really be using their toothpaste. Little simple things that we think are simple to that these everyday people that haven't had this education in the past makes a huge impact.
1,000%. Cole, what I want to, something I was thinking of, the foundation. You reached out to me talking about the foundation that you're now CEO of. Congratulations, by the way.
Thanks
Something
so
I
much.
just want to end on. I want to get back to the root message of our conversation today. I mean, we hit on a bunch of stuff, a lot of good things, but I want to get back to the core. I want to invite you, if we can host an event to host students that might be interested in the scholarship, to spread this across our platforms. I want to give us students of dentistry, elite dentists, top dental practices, my personal page, Dose of Dental podcast. We could have another event, we can have another talk, but I want to welcome to you, invite you. Let's do something. I want to open that up where we can invite everyone in. Let's get as many people on board. However, we can do a process to get as many dental students exposed to this on an international level. if
Absolutely.
if this is something, however we can help your foundation, I want this to, you had a lot of ideas, let's get these ideas to blossom, let's get them to bloom.
Absolutely.
However
No,
I
yeah,
can
let's
help
do it.
you, I'm at your service, really.
I really appreciate that. I love that. I think the best thing this profession is collaborative. It's not competition. There's people that view it a lot as there's a lot of competition and everybody wants to be, keeping up with the Joneses, right? Doing, oh, the grass is greener on this side. So and so is doing this. Let's not take it from that aspect. Let's celebrate that person that we're seeing, like, good for them. They figured it out. And then let's go talk to them. Hey, what'd you do right? Because maybe I want to do the same thing right. And let's just share ideas, because at the end of the day, there's plenty of business for everybody. There's plenty of opportunities to learn. There's so much information out there, and everybody wants to help everybody at the end of the day. That's the root cause. Let's not stray away from that. Let's go back to the
Teamwork.
core. The whole point of this profession is to help people. And some of the people that we should be helping is each other, not just our patients.
Yes, yes, teamwork. We've all
Absolutely.
seen it in on the dental school level. We grow up every 3 months, final exams, getting graded based on everyone next to you. Patient care is not like that. I couldn't have said it better than you just did right now. Cole, we got to bring that message to life. We really need to spread that, share it, and give people examples of how it applies in their life. We got to get that. We're releasing pretty soon. We're going to release the Predent Mentor Map. I want you to be a big part of that. I want the foundation to be a part of that. We're going to put, like, how do we're making like ads on there, but I want you on, I want the foundation on there, and I want students to be able to click to enter into however you want to. I don't know what you're going to do, but I want to let you know we're going to release that. There's going to be a marketplace on there, and I want to make sure that you have a spot on there so that we can give students the opportunity to get that tuition paid for. There's school's so expensive now.
It's
Students need
ridiculous.
that
Yeah.
opportunity.
Absolutely. I love it. I think it's great. I think a partnership is the way to go. I think moving forward to just being helpful of one another. I had this amazing conversation with another dentist the other day. It's that it doesn't matter your age. It doesn't matter where you're at in life. You can learn from somebody much older than you. You can learn from somebody much younger than you. We all can share something that's going to help you along the way. And it doesn't just have to be in dentistry. It can just be about life. It can be about how to tie your shoes properly. It doesn't matter what it's about. Everybody can teach somebody something. And so all you have to do is just give them that opportunity, give them your ear to learn and to pick up that information.
That's it. That's it. We got a big future together. I know it. Let's end it here for today. We'll pick this up soon. Let's talk about the scholarship program. Let's talk about getting you on the map. Let's figure out how we can add access to you guys, the pages and whatnot. Dude, thank you for coming on today.
Absolutely. Thank you for having me. This is great. This very promising future. The future was already bright. We just added a couple extra stars.
Couple extra points to the scoreboard, right?
Absolutely.
All right, brother. We'll touch base soon. I'll hit you with a DM. Let me know the next steps with that. I want to figure out how we can put that on the board. Let's put it on the map. Let's put it on the accounts. Whatever your next checkpoint is, let me know. Okay.
Absolutely. Thanks again.
All right, man. Have a good night. We'll talk soon, brother.
The same to you.
All
Take
right.
care.